Gracias. Thank you for being with us tonight. So I'm going to facilitate our workshop tonight, and I'd like to tell you what we're going to do. We're a little bit behind time, but being Hispanics, that should not surprise anyone, but we will catch up quickly. And this is what we would like to do tonight. We have some nice food and beverages available, so please help yourselves. We're going to have some introductory remarks from the sponsoring organizations. And then what we will do is I will present you with a summary of some of what is known about Hispanic health in our region. I've been doing some research. I have some data and information for you as a way to start discussing this issue. So I will do that, and then we will have a group activity, and we have this nice round table, so each table will be a group, and that's where you come in. We're really looking forward to having you share with us needs, issues, concerns, barriers related to Hispanic health in the region from your experience of us. And then after that, we will report so that we'll hear what you have been discussing as a summary. And around 8, we will be ready to close. I'd like to have a time, we are supposed to be done at 8:15, but hopefully we'll have time for all of us to also share some of your organization's experience. I know some of you have brought information to share, so that would be also a good time to form more networking. So how does that look like? Sí se puede. Yes, we can do this. All right. So what I would like to do is, before I share with you some data information I was able to find on the region related to Hispanic health, I'd like to share with you a perspective, a conceptual perspective. This is how we see this data from the perspective of public health. So I thought that would be a good way to start, because it is such a broad subject. So this, I hope, will give you some parameters and guidelines to make sense of all this data. So I will do that, then I will talk a little bit about the metro region. We have heard about it, but what exactly is the metro region? Well, I will tell you a little bit more about that, and then I will give you some information on indicators of Hispanic health in the region. So as far as a conceptual perspective or framework, this is, in our world, public health, this is where we always begin. What is health? That is a question that is at the center of our practice, at the center of our profession. What is health? Why are some people healthy and others are not? So here's the definition of health from the World Health Organization. And notice something very important. Whenever I ask what health is all about, people always pause because we don't think about health until we're sick. So health is not just the absence of disease, but something else. And there you have it, a complete state of physical, mental, and social well-being. And that's only possible when families, individuals, communities have the resources that they need to meet all their basic needs and live in healthy homes, healthy environments, free of risks. That's pretty much it. That is our goal, that's our aspiration, that is the definition of health. I bring this to you because this is more than health services. This is not the medical model of a patient and medical services, which is extremely important, and we are going to talk about that, but it's much bigger than that. It's about health, public health. So with this definition, then, when we ask ourselves then, what are some people healthy? What determines health of people and communities? We use this key set of concepts. What determines health are, of course, the determinants of health. And I love to use in my classes the iceberg metaphor, because when you look at people as you would look yourself, you don't know whether some people are healthy or not. You have to go beyond and find out what determines the quality of life, the health of a person, of a family, of a community. And when you do that, and you go below the surface, so to speak, then you see that there are a number of things that determine health. Beliefs, jobs, income, education, the places where they live, personal health, perceptions, skills, certainly the physical environment around that. All of those things are important to us. We look at them because we know that determine the health of a community, the health of a family. So these to us are the determinants of health. We're going to talk about this tonight because these are the things that will determine the health of Hispanics in our region. These are the things we're going to be talking about. So, furthermore, at the federal level, of course, Hispanic health, minority health is not new. It is part of the agenda, part of the legislation, part of the fabric of our country. As an example, the Center for Disease Control, one of the federal agencies, there are more than many agencies that have minority health in their agenda, but this is the Centers for Disease Control. And the Office of Minority Health is committed to the elimination of health disparities for populations that are vulnerable, such as Hispanics. And you can see there the 5 minority populations formally defined by government, by federal government, by state governments, and also city governments. And of course, one of them is the Hispanic or Latino communities, as you can see there. So there are about, as of July 2013, about 54 million Hispanics in the USA, 70% of the total US population. Right now, the nation's largest ethnic or race minority. And then, as you can see there, Mexicans make most of this, the Hispanic, Mexican ancestry, but so do Puerto Ricans, Salvadorans, Cubans, Dominicans, etc. So as you know, we have the evidence pointing to an increasing growth of the Hispanic population across the country. So this is the population in the USA, and I thought I would show you this, which I thought is interesting. Of course, we have been discussing a lot about immigration and immigration reform, and after what just happened yesterday about the elections, that is again being discussed. But this is an example of a poll about Hispanics and why they think it's important to them. Immigration is, but much more than immigration, it's income, jobs, health, as you can see there. 55% of these respondents, Hispanics, thought that education is really extremely important to them personally, and jobs and the economy, 54%, and about 50% healthcare. So this to us, as I just said, are the determinants of health. That's what people are thinking about. That's what our communities are thinking about. These are their concerns. So in addition, I found some information about this Hispanic community health study done and concluded just recently, large national study, well-designed, done in 4 major cities, not St. Louis, but closest is Chicago, and that telling us in the findings, as you can see there, a number of concerns that pertain to men and women of Hispanic ancestry. These are the findings of this study. And all of them are examples of issues and concerns and needs that have to do with Hispanics. we are planning to send this presentation to all of you because you gave us your email, and so that will be, you will have this presentation. We put it together for you. In this presentation, I also put the sources so you can check them out as well and use them. We will be also sending the proceedings of the entire workshop, so all of you have, the information that we're sharing. So this you will have. So these are based on the evidence we have from various studies, this is what we know as far as risk factors that may disproportionately, that is the key word, affect more Hispanics than other populations in the US. And asthma comes up on top. And so does Chagas disease, that is, probably you never heard about it. It's an infectious disease caused by a parasite. About 300,000 people have it in the USA, but mostly it's because they came from Mexico and other parts where that disease is prevalent. Sometimes it takes 10, 20 years to really manifest itself. That's why people come here, they didn't know they have it, and then of course here they are diagnosed with this disease. HIV/AIDS is in there in that list, and so is obesity, teen pregnancy, smoking and tobacco use, and infant mortality. All these risk factors are important to us because they may lead to diseases. And in the graphic there, you can see how obesity, which is a risk factor, and obesity is becoming a big issue among Hispanics, may lead to a number of health issues and diseases, diabetes being on top of the list, and many others. These are, because obesity is so important, I thought I'd share with you some information I found more recent about obesity in Hispanics in the USA. And you can see when you look at the first table, all adults in the USA, about 34.9% is the percentage, but it is higher for Latinos, 42%. When you look at children, for all adults, it's 16.9%, but it is much higher for Latinos, 22.4%. This is becoming a big issue among Hispanics. As far as mortality, we just talked about morbidity, now mortality, 10 leading causes of death, cancer, certainly up on top for Hispanics in the USA. And so is heart disease and unintentional injuries, as you can see there, stroke, diabetes, chronic liver disease, chronic lower respiratory diseases. Lower respiratory meaning not just your common flu and cold, but something much more serious such as bronchitis and COPD. Alzheimer's is there, and such as a number of kidney diseases and influenza and pneumonia. These are the 10 leading causes of mortality among Hispanics in the USA. So that is just a sort of an overall view of how we see Hispanic health from the perspective of our definition of public health and the determinants of health, and some indicators of mortality and morbidity in the USA. Now, let me now show you the region. This is our concern. And this is the San Luis Metropolitan Statistical Region. That's how it is known, the San Luis MSA, the Metro Statistical Region. There are 15 counties. The city of San Luis counts as a county. You can see the 7 counties in Missouri and the rest of the 8 counties in Illinois. The region, the metro region, is the 19th largest in the USA, 2.8 million approximately. And it has all those 15 counties that you can see there. This is a good time to share with you why we thought of the importance of a regional perspective. From our experience, from the studies we know, from the evidence we've seen, one of the big issues in our region is the fragmented system we have in the region. And you know that already from your work, I'm sure. Certainly here on this side of the river, a city and so many municipalities. A fragmentation that is manifests itself in administrative level, political level, and also at the population level. We're still a sort of fragmented, divided city, and certainly what has happened with Ferguson is such a reminder that we are not together in so many ways, which is why we thought that it is so crucial at this time to take the regional view on these issues. I always say the river should not separate us. It should bring us together as a region, because the Hispanics come back and forth, have the same similar issues. So we take a regional perspective because of those reasons. And because although Hispanics are not number-wise big population, yet the population is growing. What you see there in blue is the white population, in green is the African American or black population. We cannot see, because of the map, not that good of a quality, the yellow in Asian and the red Hispanic little spots, but we're there on both sides of the river. There we are. Now we have some numbers. For the metro area, as you can see there, the Hispanic population has been growing, and from 2010 to 2013 it has grown from 2,000 to over almost 79,000. So it has grown by 9.47%. So all in all, bottom line, the Hispanic population is growing in our region. It is growing on both sides of the river. And here you can see not only Hispanics, in this case Mexicans, but other also immigrants from other regions, other countries. Most of them still come from Mexico and Central America to the San Luis region. And I wanted to show you this because it also tells you a bit more about who they are. The level of education, which is very diverse from just elementary school all the way to higher education. As far as income, you can see there, as an average, Hispanics tend to have lower incomes than white groups. And in 4.4% are in the San Luis metro region, immigrants. So the immigrants and Hispanics as well are also diverse too. Now you have seen the region. This is our concern tonight. And now let me show you some, not all, but some information I was able to collect on Hispanic health, on the region. And I will begin with Missouri. And for this, I'm using a really useful publication put together by the Missouri Department of Health with funding from the Missouri Foundation for Health on indicators of Hispanic health in Missouri. If you would like us, we have a PDF copy of this, and I can send you this report to you if you would like me to. But I took some of this data from the report to show you this. And here we have the Hispanic population in Missouri, which is growing rapidly, still not big in numbers, but growing nevertheless. Due to two things: high fertility rates. Hispanic families have higher fertility rates, more children, but also because of immigration. So Hispanic population is growing in San Luis. However, the report itself, and you probably know this, does say that it's difficult to get information on Hispanics. And I think many of you know why. Why? Because so many of these indicators are underreported, so we don't really know the true figure for a number of reasons. Another reason, of course, is language barriers. Not all Spanish, of course, are fully bilingual, so they cannot fill out forms, they cannot report, so we don't know because of language barriers. And certainly the fact that many of them are undocumented and therefore, in a way, invisible to data collection and studies and reports, and we don't know that either. So this is the data we have, but you can see that up there in the first upper part, it's the ratio of Hispanics to non-Hispanics, that's non-Hispanic whites, 1.7, much higher. That's people that have to pay for the healthcare themselves, or have to use Medicare or another source. When you look at the median income, it's lower than 0.8 to 1, lower than non-Hispanic whites. Poverty level is almost twice for Hispanics, or twice than non-Hispanic whites. Families with children under 18 that are below poverty level, almost twice or more than twice the non-Hispanic whites, and so forth. So just the first look at what we call the determinants of health and where people, Hispanics in Missouri, are. The report has also some good information about prenatal care and birth rates. And this is comparing not only Hispanics, but also African Americans. And the reason for that is that the Missouri Department of Health also collected this information for African Americans before they did the Hispanic health report. So you see the comparison between those three groups, and Hispanics for inadequate prenatal care are much higher than non-Hispanic whites. And premature birth rates are somewhat higher than non-Hispanic whites. As far as smoking and lack of physical activity, Hispanics have a little bit higher rates than non-Hispanic whites, and the same for lack of physical activity. You may remember these are risk factors, one certainly for lung disease, the other one for obesity, and then on to diabetes. And for cancer screenings, you can see there where Hispanics are. For colorectal cancer screening, we are much higher as far as not having this type of screenings. For breast cancer, the same for Hispanics. It's a bit different for no cervical cancer screening for Hispanics. As I said, I will send you this, but my purpose was just to give you a little bit of a first look into the data we have as far as diabetes. Hispanics a little bit higher than non-Hispanic whites. Asthma higher than non-Hispanic whites. And chronic disease such as, factors such as hypertension, high cholesterol, obesity. You can see that for high cholesterol, Hispanics are much higher than any other group. So those are the leading causes of death for Hispanics in Missouri, 26 to 2010, and that's heart disease number one, cancer, unintentional injury, stroke, and diabetes. What do these have in common? What do these have in common? And this goes to the mantra in public health that we teach our students from day one. They can be preventable. All of this can be prevented. They can be preventable. Hispanic heart disease, cancer, injury, you have the same, more information on those causes of death. And I'm going to finish with Illinois. I spent many, many hours trying to find information on Illinois, and it was not easy. Again, one of our challenges is just getting the evidence, getting the information, but I was able to get some. So here's some information on Hispanic populations in Illinois, much bigger, of course, than Missouri. Illinois has the 5th largest Hispanic population in the United States. So there you have the numbers, over 2 million, 16% of Illinois population. And also I was able to get the number for undocumented Hispanics well, not only Hispanics, residents in Illinois, which is a sizable, over 500,000 residents. Probably, I suspect, many of them, if not most, are Hispanics. A bit more about then the determinants of health on socioeconomic data, income and wages. As we've seen within national data, income and wages in Illinois for Hispanics tend to be lower than whites. And you have some information on Hispanics living in poverty. 17 and younger, 31%, which is, gives you an idea of their concerns as far as income in these populations. As far as education, if you can see actually in the table up there, less than high school is 49% of foreign-born Latinos. So those Hispanics who had come from other countries, 49% of those have less than high school. That changes for Latinos or Hispanics born in Illinois. And as far as health insurance, Hispanics in Illinois, 26% are uninsured. So insurance is still an issue in Illinois and in Missouri, in our region. And that means, of course, access to healthcare services. I was able to find something about diabetes because that's such a big issue among Hispanics in general. So that is some information on Illinois. Hispanics have double the risk of developing diabetes compared to non-Hispanic whites. And it's that we're seeing that at younger ages among Hispanics. Although the higher the education, the lower the prevalence of diabetes. But Illinois had one of the highest rates among middle-aged adults, 45 to 54, in diabetes. As far as cancer, some information on breast cancer for Illinois and Missouri this time. As far as breast cancer, the Hispanics are actually doing better than non-Hispanic whites. Of course, it's still an issue for many. And something that is appearing now in our Hispanic health agenda is the issue of testicular cancer, especially among young Hispanic men. I was not able to find data for Missouri and Illinois, but all the reports I saw are pointing to this emerging issue among young Hispanic males in this country, and certainly in the two states, I'm sure. A little bit to finish this on women's health. And this from a particular study that was reported by the Chicago Tribune in 2011. 34.3% of Latino women in Illinois said their health was not good, compared to 8.5% of non-Hispanic women. And they are reporting higher rates of diabetes, cardiovascular disease, and obesity. And I wanted to, last slide, to finish with this. And this is, we're talking about, of course, cities and towns, but many Hispanics don't live in cities and towns. They live in rural areas, so that we don't forget them. This is the region is big geographically, so there are Hispanics living in rural areas with a number of issues, such as related to access to healthcare services. This is an interesting study that did focus groups with, it was, 181 participants in northern Illinois. But it gives you an idea of the kind of issues that these Hispanics in rural areas are concerned about, and what are those? Healthcare insurance, health insurance coverage, lack of access, high costs, communication issues, and that of course has to do with not speaking Spanish or not having translators sometimes, legal status, discrimination, and transportation issues. This was a very brief, just to get started on what we know about Hispanics in the metro region.